Hi, my name is John, and today I'm going to be demonstrating the ReliaFit external urinary device application. ReliaFit is an external urinary device that can be added to your hospital protocol for CAUTI avoidance. CAUTIs are on everybody's radar. They're expensive, they're bad for patients, they can affect your scores. So the easiest way to avoid a CAUTI is to avoid unnecessary indwelling catheters. Most hospitals have adopted a nurse-driven protocol for Foley removal, which is great. The problem is once a Foley comes out, if the patient is still incontinent, what are the options? I think we would agree condom caths don't work. Briefs and pads need to be changed every few hours and eventually are going to lead to skin breakdown, pressure ulcers. So the ReliaFit device is a completely nurse-driven option. There's no physician order required. It's a one size fits most. It's going to work circumcised, uncircumcised, and retracted. And I'm going to open up the kits and show you how to apply. So two kits are available, clear kit and a blue kit. If you remember, blue is for new or blue is for new patient. This has calf grip, which is a leg securement device. That's the only difference between the two, and I'll talk about that in a few minutes. So, as I said, one size fits most, perforated top, easy to open. Inside your kit, you're going to have everything that you need. There's going to be instructions. There's going to be calf grip, your leg securement for your urine tubing for your urine bag, a vial of Mastisol, which is that adhesive that's going to help keep everything together, alcohol prep wipe, and then the device itself. I usually say as long as you can find about a half-inch worth of real estate, that's typically enough to have a successful application, as long as you can get the area dry and clean prior to application. So the first thing that you want to do is use your alcohol prep. You're going to remove any type of moisturizers or oils, uncircumcised. Foreskin's going to need to be retracted. And then you're just removing, as I said, moisturizers or soaps or anything that could impact how long the device is going to stay on from the glands. Next, what you want to do, take your Mastisol. This is a liquid non-water soluble adhesive. It's designed to keep the device intact. Works great for this type of application. You're going to want to crack the vial, open it up, and then just hold upside down for a couple seconds or give it a shake. You don't need to squeeze. If you squeeze, too much liquid's going to come out. It's going to take a long time for that to dry. What I recommend doing is just nick your glove. Hopefully you can see that that is coming out very easily. It can be difficult to see this on the skin, especially in a dimly lit area or dimly lit room. You're just going to want to go small amount, 360 degrees, all the way along the glands. Now that's going to take small amount, usually about 45 seconds for that to dry and become tacky. So what I like to say is as that's drying, go ahead and turn your focus onto applying the leg securement. Whether you're using calf grip or if you're using alternative. Calf grip is hydrocolloid, so it's very flexible. It's not going to pinch, it's not going to pull. And then it has adjustable silicone ties, so you can adjust and readjust the tubing as needed without having to press really hard against that patient's leg. With this, you're going to want to apply inside of the thigh, close to the knee. Once you have this in place, this should be pretty tacky and ready to have the device applied. Open up your ReliaFit device. This is what the ReliaFit device looks like. One-way vent always goes on top. It's nothing that you can pull a sample from. It is something that's going to allow a little bit of air to get in there. The air is going to help make sure that there's no pooling and draw the urine away from the skin. Two securements. I call this the collar, and then I call this the flower. They're both a hydrocolloid-based material, so it's very skin friendly, very flexible. Two ways you can apply this. You can apply it all at one time, or if you prefer, remove the collar. This gives you a little bit more room. You can apply this and then put the collar on separately. I'm going to show you how to apply it when it's all in one piece. That's the way that I prefer. What you're going to do is you're going to pull the backing on the flower, and then you're going to go opening to opening, taking a moment to press down each petal. Now if those petals don't stick, that is a sign that the Mastisol has not fully dried and become tacky. You're going to have to just wait a little bit longer. Next, what you're going to do is you're going to overlap these petals with the collar, one side at a time. With the collar, I think it's a lot easier to use two hands, one to kind of hold it in place and the other to pull, making sure that you pull snug as you apply. Same thing on the other side. Now I'm putting this on snug. I'm not encouraging you to make a tourniquet. However, this is very flexible, stretchy material. It's going to acclimate to your patient's skin. It's not going to cause any discomfort. Make sure that this is flush against the skin. Uncircumcised foreskin will go back over. Retracted, it can go back in. This will plug right into your urine tubing bag. Best part about the device, you can leave this on until it falls off. Typically, our average wear time is about 24 hours for the first device. Once that first device falls off, 48 hours for a second one. What will happen is this hydrocolloid is naturally going to wick moisture away from the skin. As it becomes saturated, it's going to turn a clear, cloudy color. Eventually, it's just going to peel off, start leaking, or fall off. At that point, put the next one on. Essentially, the next one is going on drier skin, so it's going to outlast the first one. Now, those are just our average wear times. I see wear times all the time in ICU patients or non-mobile patients, 5 days plus, and that's patients on Lasix, patients that have high output. So if it's applied correctly, it can definitely stay on quite well. If you need to remove one, say patient develops obstruction, this needs to come off, you're going to want to use an adhesive remover. I prefer the Detach-All adhesive remover. This is non-alcohol, non-acetone based, so it's not going to sting. It's really easy to use. You would just, same idea, crack the vial. Once you get the adhesive remover underneath the ReliaFit, saturate the area and it'll just slide right off. So this is something that takes a little bit of technique to do. The more times you do it, the better you'll get. So if your first application doesn't work out too well, hopefully the more that you use it, the better it will become. Best of luck. I hope this helps. Thanks for your time.